Good afternoon, my name is Fernanda Matute and I will talk about metformin versus placebo in of a pregnant woman without diabetes mellitus. What is metformin? Metformin is a medicine for all diabetes type 2 that helps control the level of sugar in the blood.
Hi, I'm Dr. Greg Castello, board certified family practice with Castello Wellness and Adventist Health Partners. And today we're going to talk about metformin or glucophage, the most popular diabetic drug, I believe, in the world. It's a fabulous drug, and if you're here today, it's probably because I either sent you to listen to it because I'm starting you on metformin, or because you have an interest in diabetes or you're diabetic itself. So metformin or glucophage is a anti-diabetic drug. It is the only anti-diabetic drug that has definitively been shown to decrease cardiovascular events. So we treat diabetes because it causes heart attacks, and it's really the only drug who actually has been proven to decrease the chance of heart attack. The actual current day metformin was discovered in 1922 as an anti-diabetic drug. It unfortunately showed up at the same time that we were starting to be able to make synthetic insulins, and insulin became all the rage for diabetes, and it actually was on the back shelf for over 40 years until it showed up again in Europe and was first brought to Europe in 1958 and Canada in 1972. It didn't come to the United States until 1995. The metformin molecule actually is derived from a French lilac flower. It's described for at least several hundred years in the literature. The ancient Greeks actually did not know what diabetes was, but they described a condition where people were thirsty and their urine was sweet tasting. So the doctors back in that day actually would stick their finger in urine and taste it and analyze it, and knew that there was a sweet taste or sugar in the urine, and eating the lilac flower seemed to decrease this. So they didn't have sophisticated terminology, but they were describing diabetes, and they actually were using a version of modern day metformin to treat it. What's interesting about metformin is that it works on the liver's production of glucose. So normally as a non-diabetic, when you eat a meal, your liver is quiet and it doesn't make sugar or glucose or gluconeogenesis. When you're hungry or starving, your liver's supposed to be able to make sugar to keep you from starving. Ironically, as a diabetic, the signals in your system are goofed up, and you actually, after a meal, not only do you have sugar in your bloodstream from the meal, but your liver actually inappropriately produces glucose, which adds to the elevated sugar. When we have higher sugars, we have higher insulin levels. We talked about that before, and you are actually hungry. So metformin is a great first-line drug. It actually can help you lose weight. It may help you lose weight if you are insulin dependent or insulin resistant or pre-diabetic. You don't actually have to be diabetic to use metformin. We use it in people with polycystic ovary syndrome, people with low blood sugar reactions. It does not cause hypoglycemia or low blood sugar as a side effect because it only converts you back to normal. So it turns off the inappropriate release of glucose from the liver, not the appropriate release.
Medical application of metformin. It is going to be application to diabetes type 2, lower weight, triglyceride and fatty liver disease, high testosterone, preventing and taming.
The major side effects of metformin are related to the gastrointestinal tract. There may be some crampy abdominal pain, some diarrhea, loose bowel movements. Some people get a little bit anorectic. They lose their appetite in metformin. They may even get a metallic taste in their mouth that is associated with the administration of metformin. About 10% of people are unable to tolerate metformin because of these gastrointestinal side effects. And metformin is not to be used in people who have impaired kidney function, and all patients should check with their doctor what their level of kidney function is to make sure that metformin is not contraindicated for them. But metformin has a long track record of efficacy and safety, and it is the number one drug that's recommended by the American Diabetes Association, the European Diabetes Association, and the American Association of Clinical Endocrinologists to initiate treatment in patients with type 2 diabetes.
There was an article from metformin, a placebo in obese pregnant without diabetes mellitus. That article tried that some woman is used to the metformin when it is pregnant to lose weight and don't affect the baby.
CTV National News with Lloyd.
Intriguing new cancer research. Scientists say a common pill used to treat diabetes could double as an anti-cancer treatment and cost patients less than 50 cents a day. Further studies are now underway in Canada and around the world to determine if repurposing this cheap pill called metformin can breathe new life into cancer treatment. More on the remarkable findings from CTV's medical specialist, Davis Favreau.
This old medication is now hot property in the scientific world because this total cost 42 cents a day holds the potential to treat, possibly prevent some forms of cancer.
It's important that we develop this drug as quickly as we can because if it does prove to be beneficial, we need to get it out to patients.
Metformin is now widely used for type 2 diabetes with few side effects. 2 new studies confirm it may also have anti-cancer properties. One study suggests smokers may be able to take it to prevent lung cancer. Another animal study showed it blocked tumor development by 73%. A second study found it eliminated early signs of colon cancer in human patients. And scientists say there have been dozens of other studies suggesting it may work in breast and prostate cancer too.
If the research is fruitful, there's every reason to believe that this will not only be an innovative cancer treatment, but it will be a very inexpensive cancer treatment.
Unlike chemotherapy and radiation, which burn and poison cancer cells, metformin's effect may be more subtle.
It's not necessarily killing them, it's actually suppressing their growth. Then without growth, the cells eventually die.
Dr. Pam.
A disadvantage of metformin is called diarrhea, stomachache, flatulence, constipation, unless metallic tasting in the mouth, acidity, headache, reddening of the skin, nail chains, and muscular pain. Thank you.